Welcome to my channel, guys. And in this video, I'm going to talk about adrenergic antagonist. Okay, so we can divide adrenergic antagonist into alpha adrenergic antagonist and beta adrenergic antagonist. In this video, I'm going to talk about the alpha adrenergic antagonist. So we can divide this alpha adrenergic antagonist into two types. There is non-selective and there is the selective alpha adrenergic antagonist. Okay, so non-selective can be divided again into two types. There is irreversible and there is the reversible alpha adrenergic antagonist. Irreversible, here we have phenoxybenzamine and in reversible we have phentolamine. In selective alpha adrenergic antagonist, we have alpha 1 adrenergic antagonists like prazosin, terazosin, toxazosin, tamsulosin, and we have alpha 2 adrenergic antagonists like yohimbine, and idazoxan. Mainly, alpha 2 adrenergic antagonists are rarely used or not used at all. So we are not going to talk about the alpha 2 here. We're going to talk about the non-selective and the alpha 1 selective adrenergic antagonists. So let's see what are their pharmacological effects. So if we talk about the cardiovascular system, at first, they decrease the peripheral vascular resistance. How they decrease the peripheral vascular resistance? Okay, they antagonize the action of norepinephrine and epinephrine on alpha 1 receptor. Okay, but the beta 2 receptor is empty to bind with the norepinephrine and epinephrine. Okay, and this causes, and when the norepinephrine and epinephrine bind with the beta 2 receptor, and this causes vasodilation, right? And it leads to decrease in the peripheral vascular resistance, and this leads to decrease in the blood pressure. What can be the side effects in cardiovascular system? That they can produce postural hypotension, right? What is postural hypotension? And by the way, when a person stands from the sitting position, gravity pulls the blood towards itself, right? In compensation, body activates sympathetic nervous system and it causes vasoconstriction through alpha 1 mediated action, okay, or through alpha 1 receptor, and maintain the blood pressure. But when we use alpha 1 antagonist, then this alpha 1 receptor is blocked. So norepinephrine and epinephrine can't bind with the alpha 1 receptor, and they can't cause vasoconstriction, and this leads to postural hypotension. This means hypotension or decrease in blood pressure with changing in posture, okay? But there is the beta 1 receptor in the heart which is not blocked, okay? Then norepinephrine and epinephrine can bind with this beta 1 receptor and causes tachycardia. Tachycardia or increase in heart rate, and this is called the reflex tachycardia. Okay, what are the other pharmacological effects? Like it can cause nasal stiffness, because it dilates the nasal mucosal blood vessels. Okay, it can cause meiosis. When the alpha 1 receptor is blocked, then parasympathetic nervous system gets the upper hand, and it causes constriction. It causes constriction of people by acting on the constrictor pupillary. Okay, so it causes meiosis, and it also decreases the resistance to the flow of urine. Why it decreases the resistance of flow of urine? Because it dilates the sphincter, and it contracts the detrusor muscle. Okay, and thus it decreases the resistance to the flow of urine, and this thing is used in benign prostatic hypertrophy. So we use alpha 1 selective antagonist for benign prostatic hypertrophy, and because there is retention of urine in the benign prostatic hypertrophy, and in treatment of urinary retention in benign prostatic hypertrophy, we use the drug called tamsulosin. Okay, tamsulosin is alpha 1 selective, but why we use specifically tamsulosin? Because there is 3 subtypes of tamsulosin, like alpha 1A, alpha 1B, and alpha 1D subtype. So tamsulosin is selective to alpha 1A and alpha 1D subtype. Okay, and in the prostate smooth muscle, we have this alpha 1A subtype mainly. Okay, so it has more effect or intense effect on prostate smooth muscle, but it has less effect. Means tamsulosin has less effect on vascular smooth muscle. Okay, which has the alpha 1b subtype, and tamsulosin is not selective to alpha 1b. So there is less chance of postural hypotension. Right? Now let's see the uses of alpha 1 adrenergic antagonist. We have talked about benign prostatic hypertrophy. Um, then I want to talk about pheochromocytoma. This is the tumor of adrenal medulla. And when there's a tumor of adrenal medulla, it increases the norepinephrine and epinephrine secretion from the adrenal medulla. And it causes hypertension, headache, palpitation, and sweating. In pheochromocytoma, the drug we used is phenoxybenzamine. Because phenoxybenzamine is the non-selective alpha adrenergic antagonist and is also irreversible. Okay, why it is irreversible? Because it binds with the alpha receptor with covalent bond. Okay, so it is a very strong bonding, so it can't be easily broken. Okay, so it's irreversible. And it decreases the effect of catecholamine on alpha receptor, mainly in the blood vessels. Okay, and so it decreases the blood pressure. What can be the adverse effects of using phenoxybenzamine? Okay, so it can cause tachycardia, nasal stiffness, postural hypotension, and decrease of ejaculation or problem in ejaculation. Okay. We also use beta antagonist in pheochromocytoma, but we will talk about it in later videos when we'll talk about beta adrenergic antagonist. Okay. Now let's talk about other uses like chronic hypertension. We use alpha adrenergic antagonist in chronic hypertension, and we mainly use prazosin, terazosin, and doxazosin. Okay. Among them, these two are extensively metabolized by the liver. So, because they are extensively metabolized by the liver, they have the shortest half-lives. And here, doxazosin has the highest half-life, about 22 hours. Okay. Alpha adrenergic antagonists are the second line treatment for hypertension because we have better drugs for hypertension as the first line treatment. And we can't give it to or don't give it to young people. Okay. Because it causes inhibition of ejaculation. And if there is a person hypertension with benign prostatic hypertrophy, we mainly choose the prazosin, terazosin, or doxazosin for their treatment because it is selective to alpha 1A, alpha 1B, and alpha 1D subtype. So this is the drug of choice for hypertension with benign prostatic hypertrophy. Okay. In benign prostatic hypertrophy, we have other two drugs like alfuzosin and silodosin. Okay. Here, there is something to talk about this tamsulosin. That benign prostatic hypertrophy is common in older peoples, and there is something called cataract that is also common in older peoples. So in cataract surgery, if the person is on tamsulosin treatment, there's increased risk of intraoperative floppy iris syndrome. Okay. So it is suggestive that before several weeks of cataract surgery, the person should stop taking tamsulosin. Okay. That's all for this video, and we will talk about the beta adrenergic antagonist in our next video.